morning, friends. I am Dr. Sharad Kumar, practicing endocrinologist at Lucknow, India. I did my MBBS, MD medicine, and then DM in endocrinology, also DNB in endocrinology from BHU Varanasi. Currently, I am working as professor in the Department of Medicine at Eras Medical College, Lucknow. Friends, we often keep on discussing about the lifestyle changes that are very necessary in the management of day-to-day lifestyle related diseases, diabetes being the most common of all those. What exactly are these lifestyle diseases? The most important thing out of all these important factors which are to be considered here is a diet. And there is a lot of confusion in the minds of not only patients but also in the minds of physicians as to what to prescribe in 2 minutes to every patient. Now I wanted to simplify it very clearly that a diet which is good, a nutritious, healthy, balanced diet which is good for anybody is good for a diabetic patient. So this being the summary, I feel that the restrictions which are being imposed on these diabetic patients are not only often unwarranted but may sometimes be even dangerous. The practice of stopping all fruits in diabetic persons is a highly objectionable suggestion. So all my diabetic friends, I tell them that you can take all fruits in moderate quantities. And fruit juices, however, which are not good for anybody, are not good for diabetic patients as well. Second thing is rice. Unnecessarily, rice and potato are being blamed as villain in the diabetes management. Unfortunately, most of the patients are point blank, they are refused flatly that they just cannot take potato or rice. On the contrary, the two things can be combined in the total dietary schedule as per the caloric requirement of the patient. What we have to see is that the caloric requirement should not be more than what is required. And the diet for every patient should be such that his caloric requirement is there to maintain his or her ideal body weight. If he is obese, he should try to reduce weight. If he is thin, he should try to increase weight. And the aim should be to achieve a normal weight for the prescribed height and sex of the patient. Having told about diet, the most important thing which I have already discussed, the second important thing is about exercise. So an average index patient, say a middle-aged patient, the simplest advice that we can give to that patient is that a brisk walk for around 30 minutes should be good enough for an average patient. If he is young, very energetic, then of course we can increase it to a certain extent, but for any person this should suffice. And third thing is a healthy mindset. If we go by Hindu mythology and Hindu saying, Jahe vidhi rakhe Ram, tahe vidhi rahiye. So if we can compromise with the situations and if we can tolerate the situations, I think we can do lot good to ourselves. And not only to ourselves but our blood pressure, to our sugar, body weight and the mindset. So this is in nutshell I wanted to tell all my diabetic patients that they can observe for the better control of their diabetes and other lifestyle diseases. Thank you very much.